Joey Corsi has been playing sports since the age of 5. Now in high school, he's a star lacrosse and ice hockey player. Joey also has asthma.
So as you know, nice deep breaths, mouth half open. Go, Joe. And again. Great.
It's been normal for the most part, besides taking my inhaler when needed.
Joey's pediatrician, Dr. Pete Rochelle, diagnosed him with asthma at about 1 year old, after Joey's mom, Suzanne, brought him in during a flare-up.
I was very concerned, my husband and I, when Dr. Pete gave us the news that he had asthma. Dr. Pete quickly reassured us that everything was going to be fine, and we educated ourselves through Dr. Pete, and we've gotten through many flare-ups since then, and it's been okay for him.
Dr. Pete says asthma is really just a lung sensitivity.
Asthma is all about atopy, A-T-O-P-Y. Now, that's not only a good Scrabble word, but it actually stands for essentially being sensitive. Many individuals have asthma, and it can range from mild to moderate to severe. Thankfully, there are not many patients that I have that have severe asthma.
Dr. Pete says it's important to know your child's triggers when it comes to asthma. Factors like environmental allergies can cause asthma symptoms to flare up.
To a given trigger, those muscles, they get constricted, and that actually decreases the amount of space that air has to travel. When that happens, it gives us symptoms. Those with asthma will have coughing, wheezing, and shortness of breath.
Triggers include colds or infections, environmental or food allergies, inhaled irritants, and stress. So how can you tell if your child has asthma?
In the first year of life, one can have viral-induced wheezing or bronchiolitis, and no guarantee, but when we have an infant that has wheezed in the first 12 months of life, a good percentage will continue to have wheezing, and it actually is the sign that they are going to have asthma.
And asthma often runs in the family.
So it's not a surprise when we ask history from patients that there are other family members who have had something involving the lungs that is kind of over the fence, if not a real diagnosis of asthma or allergy.
Like in the case of Joey's younger sister, Caitlin.
Living through Joey's, it was okay. I wasn't as nervous, so I knew that it was going to be okay. But not every 2 children are the same. Not every 2 children need the same medication, and they are not the same. So we have 2 different schedules, medications for both children, but as a whole, they both live active, normal lives.
Still, there are risks associated with the condition.
Asthma can threaten life. So we have to take it very seriously as an entity that has to be watched closely and medicated properly depending on the degree of asthma that we have. There are many medications that are very, very helpful in preventing acute exacerbations of asthma. When we need to, there are maintenance medications that will prevent exacerbations of asthma. Now, if we have allergens as a primary trigger, we want to use antihistamines. We want to see an allergist in specialty consultation to delineate what particular allergens we have so that we can avoid them.
Suzanne says raising 2 kids with asthma hasn't been easy.
It's been challenging. I've had to become very organized. I've had to make sure I've always been prepared. A flare-up can happen at any time. So I have to make sure I have the medication. I have to make sure, no matter if they're in my presence, or if not in my presence, everyone around them or who's in their lives has to be aware of their needs and their medications.
What are you up to?
But with Dr. Pete's help, she says it hasn't been overwhelming.
It's not difficult to manage because I have a phenomenal pediatrician. I work very hard as a team with him and their allergists. So therefore, I feel that we have everything under control at all times. And it's not as scary as it actually sounds.
Asthma symptoms may even lessen as the child gets older.
A large percentage of our pediatric patients will actually outgrow significant asthma after age 6 or 8. In older childhood, we see less and less need for nebulized breathing treatments and inhaled medications.
Joey says having asthma hasn't held him back. In fact, he hopes to keep playing sports in college.
Don't let it restrict you from trying anything, and just live your life.
And Suzanne has high hopes for both her asthmatic children.
My hopes are for them to live normal lives, no restrictions, no boundaries, especially with sports, since it is Joey's passion and love, which he does every day and continues to do. So I just want them to be happy and healthy.